Hello, my name is Emma Gell. I am a student nurse in the Community Living Center in the Veterans Affairs Hospital. I am going to present a patient to you. Patient is 55-year-old Caucasian male. He used to work as a construction worker and is now retired. Patient was admitted to the ER on February 3, 2015 for chest pain associated with shortness of breath and diaphoresis. Patient described pain as, quote, an oversized bowling ball sitting on my chest, end quote. Pain increases with exercise but subsides after 15 to 20 minutes of rest. With increasing frequency of chest pain, his girlfriend became worried and brought him into the ER where he was given 325 milligrams of aspirin by mouth and 1 sublingual nitroglycerin for the chest pain. Pain was described as 7 out of 10 intensity upon admittance to the ER and was reduced to 1 out of 10 intensity after pharmacological interventions. An echocardiogram was performed and patient was diagnosed with heart valve disease. Patient was told the heart valve disease was the cause of his heart attack. He is still waiting to be scheduled for open heart surgery to replace his mitral valve. Vital signs: blood pressure 148/96, heart rate 76 beats per minute, respiratory rate 16 respirations per minute, oxygen saturation 100% on-room air, temperature 37.1 degrees Celsius taken orally. Medical history: patient has a past medical history of diabetes, hypertension, osteoarthritis, depression, and asthma. Patient is up to date on all immunizations and has no known allergies. Patient has been hospitalized once before current hospitalization for the amputation of his toes 3 months ago. Phalange 4 and 5 on the right foot and hallux on the left foot were amputated due to uncontrolled diabetes. Diabetes is still uncontrolled. Patient is on medications to reduce chest pain and risk of heart attack, lower blood pressure, and reduce inflammation of the joints. He is also on pain relievers and insulin injection. Functional assessment: patient denies alcohol or tobacco or illegal drug use. Patient walked 1 mile per day before admittance to hospital. He sleeps 6 to 8 hours every night and denies any sleeping disorders. Patient has experienced a decrease in appetite since arrival to the hospital, mainly due to his dislike of the food offered. Patient's decreased appetite has resulted in poor nutrition and poorly regulated diabetes. Patient drinks 1 cup of caffeinated coffee every morning. He is confined to his wheelchair in the hospital, and although he is compliant, he feels it is unnecessary. Psychosocial: patient's wife died 7 years ago of lung cancer and now lives with his girlfriend of 4 years on his farm in Chelsea. He has acquaintances with his neighbors, but does not have any close friends. Patient is not religious, but attends Catholic Mass every Sunday for his girlfriend. Patient has 3 dogs and 10 to 15 stray cats that, quote, come and go as they please, end quote. Patient does not identify any stressors in his life and is very close with his girlfriend. Family history: patient is adopted with little known information about his biological family. He knows that his biological mother was an alcoholic and died during childbirth. His biological father is unknown. Nothing is known of his biological grandparents. His adopted parents are still both living, and patient has a good relationship with both of them. Cardiovascular: due to his diagnosis of heart valve disease and history of myocardial infarction, I performed a cardiovascular assessment. Review of system: patient experienced increased chest pain in the several months leading up to his admittance into the hospital. Patient denies any arm or jaw numbness. Patient has a history of high blood pressure. Patient has noticed increased fatigue during his daily mile walk. Patient has no difficulty lying flat and uses 1 pillow to sleep. Patient experiences heart palpitations roughly once a month. Examination: no heaves or lifts upon inspection and no lifts or thrills upon palpation. PMI was palpated. S1 and S2 sounds were auscultated. No S3 or S4 sounds were heard. Heart murmur was auscultated due to heart valve disease. Peripheral vascular: because of his toe amputations, due to poor circulations from uncontrolled diabetes and potential circulation problems due to his heart valve disease, I performed a peripheral vascular assessment. Review of systems: patient denies any pain in legs, calves, thighs, or hips while walking. Slight edema of the feet. No coolness or hair loss of extremities. No history of blood clots in legs. Some varicose veins on lower extremities. Examination: Varicosity is found on posterior and anterior lower legs and posterior upper legs upon inspection. Legs were slightly paler, even hair distribution. Edema of the feet, no ulcers. Patient's pulse were rated as follows. Temporal pulse, 2+. Carotid pulse, 2+. Brachial pulse, 2+. Radial pulse, 2+. Femoral pulse, 1+. Popliteal pulse, 1+. Posterior tibial pulse, 1+. Dorsalis pedis pulse, 1+. Upon palpation, slight tenderness and 1+ edema of the feet. Varicosities present. Warmth equal bilaterally. Capillary refill less than 3 seconds in fingers and slightly greater than 3 seconds in existing toes. Another pertinent system to assess would be the musculoskeletal system because of patient's history of osteoarthritis and amputation of the toes. According to an article published in Pain Management Nursing, osteoarthritis is associated with joint destruction, chronic pain, and changes in proprioception, stability, and range of motion. Due to his missing toes and osteoarthritis symptoms, patient's mobility is likely to reduce. This would result in decreased venous return because of reduced contraction of skeletal muscles and therefore decreased cardiac output. It is important to assess the musculoskeletal system because it is directly related to the peripheral vascular system and cardiovascular system. Because of his poor circulation due to diabetes and heart disease, patient is at high risk for developing ulcers, so it is pertinent to also assess the integumentary system. An article in PubMed Central published by the National Center for Biotechnology Information stated, in people with diabetes, foot ulcers frequently coexist with vascular insufficiency, although foot ulcers can occur in people with no vascular insufficiency, and may be complicated by infection. Amputation is indicated if disease is severe or does not improve with conservative treatment. Patient is at high risk for ulcers due to diabetes and cardiovascular disease, so by assessing the condition of his skin, nurses can prevent the formation and progression of ulcers.